Hello, I am Dr. Rajita, faculty of Next Fellow. Today we are going to discuss about the bronchopulmonary segments. So bronchopulmonary segments, if we see, they are anatomical, functional and surgical units of the lung, and each bronchopulmonary segment can be resected surgically separately. So that is the surgical importance. And if we see the lung, each lobe, that is the right lung has got upper lobe, middle and inferior lobe. Left lung has got the upper lobe, then inferior lobe. And upper lobe is again has got the lingular segments. So let us discuss, enlist the bronchopulmonary segments in each lung. So if we see first on the left side, left lung. So left lung, upper lobe has got anterior, posterior, that is apical anterior and apical posterior, and lingular we can say superior lingular, inferior lingular. So this is on the left side, superior lingular and inferior lingular. And apart from that, in the lower lobe we got apical anterior, apical basal, then anterior basal, posterior basal, medial basal and lateral basal. Instead of superior and inferior lingular, which we have seen on the left side, on the right side there are medial and lateral bronchopulmonary segments in the middle lobe. So this is how we enlist all the bronchopulmonary segments. So the most important thing is the seventh bronchopulmonary segment, that is the anterior basal bronchopulmonary segment, this yellow one, anterior basal bronchopulmonary segment. It can be called as, on the right side, it can be called as cardiac bronchopulmonary segment. On the right side, it is called as cardiac bronchopulmonary segment. That is the other name of bronchopulmonary segment on the right side. So here is the schematic image of each bronchopulmonary segment showing its content. So as I said earlier, it is a wedge shaped largest subdivision of each lobe of lung, and each bronchopulmonary segment, if we see, it is aerated by its own segmental bronchus. So this one is, purple one is the segmental bronchus, which are along with the bronchial artery and bronchial vein or pulmonary artery. So it has got the bronchial artery, which is a segmental branch, and pulmonary artery segmental branch are along with the bronchus. And if we observe along the intersegmental planes, that is in between the segments within the connective tissue, there are pulmonary veins. These red colored structures are the pulmonary veins. The pulmonary arteries are shown in blue color and pulmonary veins are shown in red color because pulmonary veins carry oxygenated blood. So the tributaries of pulmonary veins are intersegmental and they lie at the margins of bronchopulmonary segments. And this margins, they create the surgical planes which a surgeon can follow for the segmental resection with minimal tissue damage. So that is the reason these bronchopulmonary segments are very important surgically. So if we talk about the arterial supply of bronchopulmonary segment, it is supplied by bronchial artery, which we saw in previous image, which supplies bronchial tree and pulmonary tissue. And the right bronchial artery arises from the third posterior intercostal artery, and whereas on the left side there are two bronchial arteries, and to the which give supply the left lung, and they arise from the descending thoracic aorta. So these things to be noted. Venous drainage, the first one and two divisions of bronchi, drains into bronchial veins, and right bronchial vein drains into azygos, left bronchial veins drains into hemiazygos. Talking about the lymphatic drainage, the lungs are drained into superficial and deep lymphatics, and which further drain into bronchopulmonary lymph nodes. Nerve supply of the lungs, it is an involuntary organ which is not under your control. So it is supplied by sympathetic and parasympathetic, that is the autonomic nervous system. And if we talk about this parasympathetic, It is supplied by 10th cranial, that is the vagus nerve, which provides motor, secretomotor and sensory fibers. And whereas the parasympathetic nerves derived from the sympathetic ganglion, that is T2 to T5. So that is, so coming to the applied aspect of bronchopulmonary segments, it is most important to note that dependent bronchopulmonary segments, so that is in standing position you can note down as SPB. In standing, posterior basal segment of right lung is the most dependent bronchopulmonary segment, and in supine you can remember as SAL, that is supine apical segment of the lower right lung, that is the most dependent bronchopulmonary segment. So why we are knowing these dependent areas? It is very important in foreign body aspiration. So location of foreign body aspirate, it depends upon the posture of the patient and it decides the gravity force as well. So most of the aspirations, if we see, they occur in supine posture because coma or post anesthesia, post operative conditions, there is a chance of getting aspiration. So the aspirate moves into right lower, that is right lower bronchus and found in the apical. So we can remember as in supine, apical segment of lower right lung, that is in supine. And in standing and sitting, posterior basal of right lung. So that is, suppose if the aspirate enters the left lung, so it commonly gets which means lingular, that is the, to say it enters into the inferior lingular of bronchopulmonary segment is the most dependent in the left lung. So that is about the most dependent bronchopulmonary segments. Thank you.